Well, one of the problems we actually had initially was the lack of neurologists to cover all the hospitals in Singapore. So there are some peripheral hospitals which did not have round-the-clock neurologists to take care of acute stroke patients. And as a result of this, we decided to use telemedicine in order to facilitate treatment of these patients who present with acute stroke in the emergency departments of these peripheral hospitals. So this has actually overcome the difficulty we had in having neurologists being present on site in those hospitals. And this has enabled remote assessment and management of such patients who present with acute ischemic stroke at these peripheral hospitals. With the use of this telestroke system, patients have had easy access to highly specialized strokes service. So patients have been able to access the services of stroke specialists in order to assess them and to determine their eligibility for IVTPA, which we know is the FDA-approved treatment for acute ischemic stroke. So using this system, we've been able to facilitate the rapid assessment of such patients, rapid determining of their eligibility for IVTPA and the administration of IVTPA to these patients. So essentially, we have been able to save a lot of time and as a result save brain as well. There's been a tremendous increase in the number of patients who have received IVTPA once we started this telemedicine service using Krixi. So prior to that, before we used telemedicine, approximately only 10 patients per year were treated with IVTPA. The reason for this being the neurologists were not in the hospital around the clock 24/7. And once we started this service, we were able to provide stroke service 24/7, and as a result there's been a tenfold increase in the number of patients who've been treated with IVTPA. Just last year alone, we've had about 100 patients who've been successfully treated with intravenous IVTPA at one of these peripheral hospitals. Yes, we found that the Krixi system was very easy to use. The interface was actually very user-friendly, and all the components, the CT scan, the checking of the NIH stroke score, as well as the vital signs were very well illustrated on the interface. And usage of this system was very easy, and the training time was relatively short. Majority of the doctors were able to use it within about half an hour to 1 hour of just training. Yes, there are actually lots of opportunities, not only in stroke, I think, it's probably in other aspects of medicine. With the aging population, mobility may be an issue. The majority of patients may not be able to come into a hospital to see a physician directly. So, especially patients with chronic diseases who are on wheelchairs, such patients can be effectively treated and effectively consulted using this telemedicine technology. The Krixi experience has been quite positive. First of all, the implementation did not require much equipment, and it was very smooth, and it was simple implementation. The training was very effective, and the system was very easy to use. It was very user-friendly and relatively robust, and we haven't had major technical issues with it. And the good thing is the technical support has been very good. It was 24/7.